Welcome to the first episode of Wisconsin Prison Voices, a production by the Milwaukee branch of the Incarcerated Workers Organizing Committee. My name is Emily.
And my name is Ben.
The Incarcerated Workers Organizing Committee, or IWOC, is a prisoner-led section of the industrial workers of the world. IWOC builds bridges between prisoners on the inside and workers on the outside to challenge the abuses of the prison system, end highly exploitative prison labor conditions, and work for the long-term goal of prison abolition. For more information and to get involved with our organizing efforts, go to www.wisconsinprisonvoices.org and follow us on Twitter at WIPrisonVoices and on Instagram at Wisconsin Prison Voices. So the focus of this episode will be the COVID-19 pandemic in Wisconsin's prisons, a chronicle of the crisis and the ways prisoners and activists have organized against it, and the state prison system responsible for its unfolding. In putting this episode together, we relied on numerous reports and correspondence sent to IWOC by people locked inside Wisconsin's prisons during the pandemic.
The first case of the virus was reported by the Wisconsin Department of Corrections, the DOC, in early April 2020. By the end of the year, the DOC had reported over 10,400 cases. Mass outbreaks of 100 or more cases occurred in over a dozen prisons. In some prisons, such as Prairie du Chien, over 80% of the prisoners would be infected by the virus. As of January 2021, at least 25 people have died from contracting the virus in a Wisconsin prison cell. Prior to the pandemic, Wisconsin's prison system, which costs the state $1.5 billion annually, was already in crisis. While the DOC, which oversees Wisconsin's incarceration system, now refers to state prisoners as, quote, persons in our care, the reality bears little resemblance with what one associates with such a statement. Not so much care, but overcrowding, medical neglect, suicides, the torturous use of solitary confinement, extreme labor exploitation, racist disparities, and a probation system whose main achievement may be throwing people back into a cell for not even committing a crime. The outbreak of COVID-19 in the state's prisons was not an accident, but a crisis by design. The design capacity of Wisconsin's prison system is 17,654. The population at the end of August, before the virus rapidly spread throughout state prisons, was 21,337, about 20% over total capacity, with some prisons, such as Green Bay and Racine, more than 33% over capacity. As overcrowded and confined spaces, prisons, like slaughterhouses and nursing homes, have become hosts to some of the largest outbreaks of COVID-19 in the country.
Prior to the mass outbreaks, IWOC, along with other groups such as the American Civil Liberty Union of Wisconsin, Wisdom, and Ex-Incarcerated People Organizing, advocated for compassionate release. Milwaukee IWOC demanded that emergency measures be taken to protect the health of incarcerated people against the virus. IWOC specifically called for an immediate reduction of the prison population throughout the state, prohibition of transfers between correctional facilities, adoption of special protocols for interaction between prisoners and guards, testing of prison workers once a week, and free email and phone communication for prisoners who are locked down. As a candidate for governor in 2018, Tony Evers supported proposals by organizers to cut the state prison population in half. One would imagine that the threat of the coronavirus to incarcerated populations would have provided Evers with an additional impetus to pursue this goal. Unlike governors in Kentucky, Washington, and New Mexico, who ordered mass commutations for prisoners who met certain criteria, Evers did not utilize his executive powers. In addition to commuting sentences, Evers could also grant pardons, clemency, and reprieves. So reprieves are temporarily suspending a prisoner's sentence and reinstating it after the pandemic. This was a practice that was utilized by administrations in Pennsylvania and New Jersey. So this all could have happened independently of Wisconsin's gerrymandered Republican-led state legislature. But despite the threat of COVID, Governor Tony Evers and the Department of Corrections only pursued the most limited steps to reduce prison populations. The prison population may have dropped to its lowest point in over 20 years, but this was largely from limiting admissions and releasing prisoners held for extended supervision violations. Wisconsin's obsolete parole and probation system that has fueled recidivism since it was put into law in the late 1990s.
In the early months of the pandemic, reports from prisoners to IWOC already hinted at the DOC's inability to control the spread of the virus. One prisoner from Stanley wrote to IWOC in the spring, quote, "While most of the staff here are decent, caring people, the info presented to you on the DOC website is a tad misleading. There's no social distancing being practiced during dining here. We sit 4 to a table in a day room that doubles as a dining room with 90 to 100 guys all eating at the same time. Myself and some others try to keep a cushion of 6 feet while in the chow line and otherwise, but fill in the blank. Furthermore, when you read that part about personal protective equipment being made available to staff, you may get the impression that the staff are actually wearing these, but you'd be wrong. I've seen a couple of the teachers wearing masks, but that's it. The officers and other staff I see do not." The ABC News this morning quoted someone at Oshkosh Correctional as saying they don't know how the 3 inmates who tested positive there became infected. You don't have to be a reporter to ascertain that it was most likely transmitted by a staff member. End quote. Throughout the year, incarcerated people would repeatedly refer to the failure of the DOC to enforce physical distancing, the failures of some staff to wear protective equipment, and the failures to prevent staff from transmitting the virus to prisoners on the inside. In an open records request, IWOC obtained over 700 pages of emails from the DOC regarding early planning for COVID-19. The plans seem to have proceeded from the assumption that prisoners would be the ones spreading the virus, and what precautions staff should take to prevent contracting it from a prisoner. There was little to no discussion of requiring staff to get tested or do anything outside of work to reduce their own risk of contracting the virus, but instead, plenty of plans to restrict prison movement and eliminate activities.
And indeed, many prisons would go into modified lockdown, restricting movement and privileges such as access to libraries and recreational equipment. In addition to anxieties over the threat of infection, there was the additional detriment of losing the minimal privileges that can make prison bearable, significantly affecting prisoner morale and well-being. 6 months after the state issued a public shutdown, prisoners were still repeatedly noting the lack of planning by the DOC. Quote, "It seems like the DOC is actually trying to cause an outbreak." One prisoner at Fox Lake reported this as the most common reaction among prisoners and staff to the DOC's pandemic practices. The second was swearing, and others seemed resigned. Quote, "It's inevitable." From New Lisbon, one prisoner commented, quote, "They did not do anything to figure out a game plan." From Robert E. Ellsworth Correctional Center, a facility near Union Grove, quote, "They don't know what to do here if there is an outbreak." From Oshkosh, quote, "We have not showered or been given clean clothing since last Thursday, and they have no plan for us to do so going forward. There is absolutely no plan in place if the virus came into the institution." From another prisoner in Oshkosh in early October, quote, "I suspect protocols and contingency plans were not developed in advance, despite at least 6 months of lead time."
Mask wearing would not become mandatory in Wisconsin's prisons until June 4th. Despite the mandate, prisoners from across the state, from Kettle Moraine to Columbia to Prairie du Chien, reported some staff not following state protocols. One prisoner at Prairie du Chien told The Progressive in August that prison staff were refusing to wear masks. Quote, "Excuses range from false concerns that wearing masks will scare the prison population to, if prisoners don't wear one, why should I?" End quote. In some prisons, all guards were reported to be wearing masks. In others, only a few guards were reported to be disregarding masks and social distancing protocols. But, as one prisoner in Columbia noted, quote, "It only takes a few reckless ones to start an outbreak," end quote. And, as the incarcerated person from Prairie noted, and the line was repeated in correspondence from numerous prisoners, quote, "Everyone knows that the only way COVID-19 enters a prison is because of staff," end quote. In March, DOC officials suspended new admissions, work releases, transfers, and visitations. While admissions and transfers resumed in June with modifications to limit the risk of potential exposure and spread of COVID-19, according to a DOC announcement, the other moratoriums remained, meaning staff were, most likely, the transmitters of the virus.
Most of Wisconsin's prisons are located in rural areas all around the state, from the North Woods to the Corn Belt in the South. Since COVID-19 did not begin spreading into rural areas until the late summer and early fall, the cases reported by the DOC remained low. On August 15th, the DOC had reported 344 cases, mostly resulting from a mass outbreak at Waupun. But from the first day of fall on September 21st to the first day of winter 3 months later, over 8,500 additional prisoners would be infected by the virus. Looking at the numbers from the DOC, an emphasis should be placed on the fact that these are confirmed cases. While health services in the DOC issued a memo urging prisoners to report any symptoms, prisoners have their reasons for staying quiet. As one prisoner at Oshkosh told IWOC in early October, quote, "I remain asymptomatic with negative tests, but I know from my traumatic experiences in solitary confinement why inmates would not report symptoms. Quarantine is punishment," end quote. If the number of cases are potentially higher than those confirmed by the DOC, the total number of prisoner deaths and hospitalizations from the virus remain unknown until late fall. In late October, at least 3 prisoners have died of COVID-19, according to medical examiner reports. None of these reports, however, come from the DOC. Unlike the neighboring states of Minnesota and Michigan, the Wisconsin DOC, citing HIPAA laws, refused to release any information regarding the deaths and/or hospitalizations of prisoners from COVID-19. The executive director of the Wisconsin Justice Initiative, Gretchen Schultz, would say, quote, "It's a ridiculous excuse. It's not an excuse, it's a cover-up. Under DOC standards, we would never know how many people died on a highway each year," end quote.
On October 5th, IWOC-Milwaukee issued a press release. The numerous emails IWOC had received from prisoners across the state illustrated the DOC was no longer able to prevent the uncontrolled spread of COVID-19. The press release read, quote, "Columbia Correctional is on lockdown. Oshkosh Correctional is no longer has a place to isolate people testing positive for COVID-19. Everyone is in danger, and DOC is responsible for neglecting its people," end quote. Testimonies from the Oshkosh Correctional Institution demonstrated how all prisoners were put in danger. Quote, "They've ran out of room to put the positive cases. They're leaving them on the unit. There are so many infected they have no clue what to do. I watched them move 2 groups, 15 people, out of one unit, and they were going back for more when I stopped watching and went to bed at 10 p.m. last night. They moved no one off this unit. They say the number is over 50 on this unit. No ice, hot water, showers, no phones for us because they don't know what to do with all the infected people. This needs to get out that close to half of my unit, there are 6 or 7 other units infected also, came back as positive yesterday, and they are doing nothing to separate us," end quote.
Incarcerated people in Columbia Correctional lost the freedom of movement and access to showers, while some guards continued to not wear masks. One prisoner wrote, quote, "As of September 23, 2020, Columbia Correctional Institution was placed on lockdown. No movement, no phone calls, no showers. No information is forthcoming from the administration. All I know is that 2 individuals on my unit who work in food services were placed on quarantine 2 days prior to us. Word is going around that a guard came to work after testing positive with COVID-19. This isn't surprising since a lot of these guards are MAGA supporters and believe this pandemic is a hoax. They don't take safety protocol serious. Not all guards are guilty of this, but it only takes a few reckless ones to start an outbreak. The sad part of it all is that segregation is the safest place from catching it," end quote. Together with ACLU, Wisdom, and other organizations, IWOC demanded Governor Evers and the Wisconsin DOC adopt special measures for preventing the spread of the disease. As the IWOC press release concluded, quote, "It only takes one misstep to turn an isolated, overpopulated institution into a death camp. Lack of compassionate release and other promised measures to depopulate Wisconsin's prisons have made this a morbid reality," end quote.
Protests and organizing, both inside and outside Wisconsin prisons, continued throughout the pandemic year, with a flurry of activity during the fall outbreaks. As prisoners and activists have repeatedly said, a criminal sentence should not be a death sentence. On October 19th, Ex-Incarcerated People Organizing and Wisdom, a faith-based social justice organization, began holding a daily vigil outside the governor's mansion to urge Evers to acknowledge the crisis of COVID-19 in Wisconsin prisons and use his executive powers to release prisoners. After a month of holding daily vigils and with no response from the Evers administration, Expo resorted to civil disobedience, blocking the driveway to the governor's mansion on November 24th. Despite the protests, the blockade ended with no acknowledgement from Evers or anyone in his administration. Almost a week later, a group of prison abolitionists performed a direct action outside the home of DOC Secretary Kevin Carr. The abolitionists left 11 body bags in the secretary's driveway to, in the words of the group, quote, make him feel physically with the deaths he's causing, end quote. The direct action was filmed by the group and uploaded onto YouTube. While DOC Secretary Kevin Carr released a memo on November 2nd to, quote, assure every person that our agency will continue to exhaust every resource available to us in an effort to prevent the spread of COVID-19, end quote, the most feasible way of preventing a crisis, significantly reducing the prisoner population, was not pursued. Carr and the DOC may refer to prisoners as, quote, people in our care, but prisoners are submitted to whatever constitutes care inside of one of Wisconsin's 40-plus carceral institutions.
Despite the restrictions of the prison system, incarcerated people find ways to organize, using phone calls, letters, and emails to publicize and speak out against the abuses of the prison system. Another organizing tactic, long utilized by the prison resistance movement, is the hunger strike. In the fall, 2 prisoners went on hunger strike at Wisconsin Secure Program Facility in Boscobel. A maximum security prison, WSPF had 0 cases of COVID-19 among its prisoner population, but the prison went into a modified lockdown due to staff contracting the virus. At the time of the hunger strike, a total of 25 staff members had contracted the virus at WSPF. One of the prisoners from WSPF wrote to IWOC, quote, now basically what I'm getting from this is that because COs, correctional officers, refuse to cooperate with safety standards set by Governor Tony Evers and are contracting a virus, we are getting punished and are being forced to spend more time in our cells, end quote. One of the prisoners who went on hunger strike at WSPF wrote to IWOC, quote, as of today, I am back on hunger and fluid strike. I have a court order to be force-fed and have an IV put in. I will be refusing all treatment and allowing them to suit up and spray me with incapacitating agents for the cause of being removed from an illegal program that is being used to punish administrative confinement inmates. This may seem radical, but I have come to understand that diplomacy has failed and talking is not working. So now I must put my body on the line to show that I want things to change within the Department of Corrections, end quote.
The other incarcerated person who went on strike wrote, quote, all in all, we are just asking for what all people in our situation should have, and changes and conversations that need to be done, end quote. The incarcerated person issued the following demands: the return of property and electronics taken from incarcerated people, shelves big enough to hold all these items, 5 showers a week, the return of hobby supplies, no limits on how many phone calls incarcerated people are allowed per month, no restrictions on canteen, the ability to order care packages, to talk with the head doctor involved in medical services for the facility, to be referred to as people or humans versus anything else, to be fed adequate amounts of food beyond a 2,500 calorie diet, the removal and replacement of a particular unit manager at the facility, and to have certain titles renamed. For, as the incarceration person noted in a November message, quote, words do have power, and some cause power trips, end quote. As Isaiah Holmes reported in an article on the Wisconsin Examiner's website, the DOC confirmed that the demands of the hunger strike were not met following his return to eating and drinking, but, according to a DOC media representative, DOC authorities would, quote, look into the merits of his complaints, end quote. The hunger strikes at WSPF were part of a nationwide wave of prisoner resistance that began in March. A report by Perilous, a media project documenting and publicizing acts of prisoner resistance and unrest across the U.S. and Canada, counted 119 instances of prisoner resistance in the first 90 days of the COVID crisis. The acts of resistance, which range from hunger strikes to large uprisings, occurred across 39 states, with the most protests in immigrant prisons.
IWOC organized 12 phone zaps in 2020, many related to the crisis of COVID-19 in Wisconsin's prisons. A phone zap is a collective pressure action that uses phone calls to target people or institutions. Email zaps are the same thing, but sending email messages instead of calling. It's a tactic that's been used by many different movements in organizing campaigns, including many workplace campaigns, housing fights, and anti-policing work. IWOC utilizes phone zaps for the purposes of prisoner support. The general idea behind the phone zap is that landlords, city council members, corporations, and prisons, as well as other institutions that are based on exploiting people, operate out of offices that still depend on phone access for doing business. Flooding offices with phone calls interferes with their daily operations. It is a different tactic than writing a letter to a congressperson, and it's not necessarily making an appeal to establish power. Instead, it pushes against specific institutions as part of specific campaigns with a specific set of demands. The phone zaps organized in 2020 related to medical neglect, phone and computer access, group resistance charges for opposing phone restrictions, and demands for adequate medical supplies. After the federal case Scholl versus Nuchin determined prisoners were eligible for the $1,200 stimulus checks that were a part of the COVID-19 relief bill passed in spring 2020, IWOC pressured the DOC to make the necessary tax forms available and alert everyone in their custody that they were eligible.
As a specific example of one phone zap, on May 31st, IWOC received word of retaliation against prisoners at Waupun after people chanted Black Lives Matter in support of the George Floyd uprising. The incarcerated person wrote, quote, "Today, at approximately 2:45 p.m., some officer in the front office hit the switch that cut off all the phones in the entire institution for no reason. Then, the sergeant came over the intercom and announced phone pickup. The officers collected the phones, not the inmate workers. I believe this was done to upset us because they are upset about the white officer was charged with murdering George Floyd in Minneapolis. As they know, we as predominant African Americans in this prison are happy to see him charged, so they are trying to steal our joy and cause us anger. I need you all to call this institution and demand we receive the phones because they're planning to not give us the phone back and are not giving us any answers." End quote. In response, IWOC organized a phone zap on June 2nd. 2 days later, on June 4th, an inside contact wrote that the institution was giving phones back.
In a media briefing in December, Governor Evers broke his silence on the pandemic in the state's prisons. With the increased risk of COVID-19 in Wisconsin's overcrowded prisons and the outbreaks in numerous facilities, Evers was asked if it was time to consider some form of compassionate release, and if not, why. Evers responded that the prison population had decreased during the pandemic, down from about 3,000 from the beginning of the year, and he voiced his support for long-term criminal justice reform to, quote, reduce the number of people entering the system and help people exit the system in a better way. Evers, however, made no allusion to compassionate release. Evers stated, quote, "At the end of the day, we could release half of the prisoners, but if we still have community spread, it would still be getting into prisons," end quote. Evers emphasized the need to, quote, do our job outside of these institutions and break the cycle of transmission at the community level. But to repeat, the populations of Wisconsin's prisons are highly concentrated, often exceeding 1,000 prisoners in a single facility. And in some rural areas, a prison may hold one of the largest populations in the county. While Evers remarked that we are, quote, absolutely trying everything we can to stop the virus from spreading to our prison population, the DOC cannot adequately provide one key public health guideline, that is physical distancing.
While the state of Wisconsin has failed to pursue even the most common sense reforms, whether before or after COVID, incarcerated people continue to find ways to organize against the prison system. At the end of 2020, a group of prisoners filed a civil rights complaint accusing Wisconsin DOC administrators for deliberate indifference in their disregard of Center for Disease Control guidelines during the pandemic. The prisoners hope to properly protect themselves and their fellow prisoners from the pandemic by prioritizing their vaccination. As Irvand de Loire reported for an article in The Nation, the civil rights complaint Quiles et al. Versus Champagne et al. Was filed pro se, or by the prisoners themselves, with the Eastern District Court of Wisconsin in late December. All of the plaintiffs are inmates at Thompson Correctional Center, a minimum security facility east of Madison. According to their complaint, Warden Champagne and other administrators with the Wisconsin Department of Corrections displayed, quote, deliberate indifference when, contrary to established Centers for Disease Control guidelines, they housed multiple inmates in the same room with beds less than 6 feet apart, overcrowded inmates in quarantine cells, and have allowed quarantine inmates in the general population in common areas without enforcing health and safety protocols, end quote.
The plaintiffs in Quiles further allege that prison administrators knowingly and willfully flouted CDC pandemic guidelines by keeping inmates in cells without regard for social distancing, housing potentially infected inmates with the general population, and punishing anyone who complained. In response, they are asking for prisoners to be considered at a high risk and therefore prioritized for COVID-19 vaccines. Currently, the Wisconsin Department of Health Services, which is managing vaccinations statewide, lists prisoners in the second group eligible for vaccination, beginning March 1st. Quiles hopes that, where other petitions have failed, a federal lawsuit might succeed, moving the governor and the warden to release inmates to probation or parole within their own communities, outside of the prison walls. Failing that, vaccination is their only hope. Quiles stated, quote, prisoners being vaccinated immediately and without further delay is paramount. No prisoner within the Wisconsin DOC was sentenced to death, and any death caused by the inadequate response of Governor Evers and Ms. Champagne is directly attributable to these officials, end quote.
The pandemic has illustrated once again that prisons, along with policing and surveillance, enact harm, not care or safety. The prison industrial complex in Wisconsin and across the U.S. has exacerbated the COVID-19 crisis and has done nothing to resolve it, and it has made the call for abolition even more relevant. The abolition of the prison industrial complex means dismantling a system of cages and confinement and instead pursuing practices and institutions that truly care for people and communities, guaranteeing access to food, housing, and healthcare, and freedom from surveillance and detention. That concludes our first episode. You've been listening to Wisconsin Prison Voices, a production by the Milwaukee branch of the Incarcerated Workers Organizing Committee. IWOC is a prisoner-led section of the industrial workers of the world, forming bridges between prisoners on the inside and workers on the outside to challenge the abuses of the prison system, end highly exploitative prison labor conditions, and work for the long-term goal of prison abolition. For more information and to get involved with our organizing efforts, go to www.wisconsinprisonvoices.org and follow us on Twitter at WI Prison Voices and Instagram at Wisconsin Prison Voices. Please check back for future episodes that will include interviews with incarcerated and formerly incarcerated people, discussions of IWOC campaigns and research projects, and much more. Thank you for listening.